How has TB treatment historically led to drug resistance? Imagine a time when tuberculosis was a death sentence, and then suddenly, effective drugs appeared in the 1940s and 1950s. These drugs, like streptomycin and isoniazid, changed everything by making TB curable. But early on, treatments were often experimental, with inconsistent doses and durations. This inconsistency allowed the bacteria to survive and adapt. When streptomycin was used alone, the bacteria quickly developed resistance because Mycobacterium tuberculosis could mutate to survive the drug. This led doctors to combine drugs, like adding para-aminosalicylic acid, to reduce resistance. Still, resistance kept emerging, especially when treatment was not completed properly. Over time, more drugs like ethambutol, rifampicin, and pyrazinamide were added to make treatments more effective and shorter. But these complex regimens were tough for patients to follow. Side effects, limited access to health care, and forgetfulness often meant patients didn't finish their treatment. When treatment is incomplete, some bacteria survive and develop mutations that make them resistant. These resistant bacteria can then be passed from person to person, spreading multi-drug resistant and even extensively drug-resistant TB. Historically, resistance to key drugs like isoniazid, streptomycin, and rifampicin appeared as early as the 1970s. Resistant strains circulated silently for years before health systems recognized the problem. The lack of new TB drugs over the past decades has made it harder to treat resistant TB, leading to a persistent public health challenge. In essence, early TB treatments often involved using a single drug or inconsistent combinations, which gave bacteria the chance to mutate and survive. Poor adherence to treatment allowed resistant bacteria to flourish and spread. The limited development of new drugs kept the options narrow, making it even harder to combat resistant strains. Today, controlling drug-resistant TB depends on strict adherence to combination therapies, early detection of resistance, and ongoing research to develop new medications. Always consult healthcare professionals for personalized advice, and remember that stopping treatment early or not following prescribed regimens can contribute to the rise of resistant TB strains.